We're going to take some time and get information on a few different health-related topics that affect us here in Massachusetts. And for that, we're going to speak with Dr. Tony Dodek, who is Chief Medical Officer for AllWays Health Partners. Dr. Dodek, thank you so much for coming on. I appreciate it.
My pleasure.
Well, we're going to talk about a few different things, but I thought it would be good to start off with one that's a biggie, and it's a little scary, and it also has gotten a lot of press. And that's the opioid epidemic here in Massachusetts. First of all, if you could talk a little bit about the state of the epidemic here in our state and across the country and how it compares.
Sure. The opioid epidemic continues to be a significant public health problem, both locally and nationally. Nationally, opioid use led to nearly 50,000 overdose deaths in 2017. That's according to the CDC. And there's a recent report from the National Safety Council that found that opioid overdose is the top cause of preventable death in the country, followed by traffic accidents and falls.
Right.
And then more locally, in Massachusetts, we're doing a little bit better. Opioid overdose deaths are gradually declining, but we're seeing a rise in fentanyl-related overdoses. And fentanyl is a prescription drug, but it can also be manufactured illicitly, and it's in many street drugs that people are using. The latest Department of Public Health statistics found a slight drop in opioid-related overdose deaths in 2018. We've made significant progress in that regard.
And some of that I know is more and more first responders are using Narcan. That certainly is helping to save lives anyway with overdose.
Yeah, that's true. The availability of Narcan is much improved. First responders are carrying it. And at AllWays Health Partners, we've made it available for our members without any cost share, just to be sure that anyone who's on a high-dose opioid has access to naloxone.
We're speaking with Dr. Tony Dodek, who is Chief Medical Officer for AllWays Health Partners. Can we back up just for a second? Because I know I'm not entirely sure about this, and maybe others aren't. Fentanyl has been in the news a lot lately. It seems to be becoming more and more of a problem. Is fentanyl, is it a lot different than, you would hear a lot about OxyContin, which obviously has some medical uses too, but could be abused. What is fentanyl in relation to OxyContin?
Yeah, fentanyl is a much more potent opioid than OxyContin, and the fact that it's either injected or taken nasally makes it that much more potent. So the problem is that users who have obtained illicit heroin that may be tainted with fentanyl have no idea what dose they're actually injecting or snorting, and that's what makes the drug so dangerous.
It's a scary thing. It really is.
It is.
We talked about Narcan and how it can help with overdoses, but what are some of the approaches being used to combat addiction and the epidemic itself?
So Governor Baker and the legislature have taken significant steps to reduce the prescription of opioids. In Massachusetts now, if you get a first-time prescription for an opioid, the amount is limited to a 7-day supply. And there's legislation that has also encouraged more teaching of medical professionals so that they are more comfortable and informed around opioid prescribing and the dangers of addiction. There are also new legislation that allows patients to partially fill prescriptions so that if an individual feels they don't need the entire course of treatment, they can get fewer pills if they desire.
Are there places you suggest that families can find information if maybe they have a family member they're worried about or know somebody? I mean, there are resources, but do you have any suggestions?
Yeah, there are several organizations in place in the state for both families and individuals. The state has a substance use helpline at helplinema.org, and that line is free and confidential. There's also an organization called Learn to Cope, which is a nonprofit support network.
Right. Yeah, we've had them on. Yeah.
Have you? Okay, that's an excellent organization. They offer education, resources, and peer support for both parents and family members who may be coping with a loved one who's addicted to opioids or other drugs. And their website can be accessed at learntocope.org. It's learn, the number 2, cope.org.